Now we go to the 5 transporting points, the Jingwell points, spleen 1. Spleen 1 is located on the big toe, 0.5 tune from the medial corner of the nail. How to find? Spleen 1 is located at the junction of 2 tangents drawn along the medial and proximal border of the nail of the big toe, approximately 0.1 tune from the margin of the nail. Needling 0.1 to 0.2 tune vertical or obliquely in a proximal direction, or prick to bleed with a needle, lancet or 3-edge needle. For the actions, indication, spleen 1 regulates the blood, regulates the spleen, unbinds the chest, calms the shin, and revives consciousness. Special features, spleen 1 is a Jingwell point, wood point, sensing meow, ghost point, entry point, important distal point for the lower abdomen. Spleen 1 is normally used in excess patterns of the spleen. A special use of this point is with direct moxa to stop bleeding from any part of the body and particularly from the uterus. It stops bleeding by strengthening the spleen's function of holding blood. It can therefore also be used for bleeding from the nose, stomach, bladder, or intestines. Another use of this point is in cases of mental restlessness and depression in excess pattern resulting from stasis of blood. In such condition, it calms the mind and stops excessive dreaming. Summary of function, spleen 1 is normally used in excess patterns of the spleen. With direct moxibustion, it stops bleeding from any part of the body and particularly from the uterus. Mental restlessness and depression in excess patterns resulting from stasis of blood. According to the supplement of the 1000 Ducat formulas, the spleen gathers the blood. When the spleen is deficient, it is unable to unite the blood. While the treatise of disorders of blood states when spleen yang is deficient, it is unable to gather the blood. Spleen 1, the Jingwell point of the spleen channel, is one of the foremost acupuncture points for strengthening the spleen's function of holding blood in its proper place. When this function is impaired, there will be hemorrhage, usually chronic in nature and occurring in any part of the body, but most commonly in the lower jaw, whether as uterine bleeding or as bleeding into the urine or stools. In such cases, moxibustion either by moxa stick or direct cones at spleen 1 is frequently employed and is particularly helpful to instruct the patient in the daily use of moxibustion at home. The action of spleen 1 on stopping bleeding, however, is not confined to cases of spleen deficiency, but may also be applied where heat enters the blood level, giving rise to reckless bleeding. This may manifest either in the lower or the upper part of the body. For example, nosebleed or vomiting of blood. In these cases, needling or pricking to bleed is the usual method employed, although some physicians prefer to use moxibustion despite the presence of heat. The essential question states, dampness, swelling, and fullness all pertain to the spleen. Spleen 1 is able to regulate the spleen in the treatment of disorders such as abdominal distension, swelling of the limbs, diarrhea, etc. But as the Jingwell and therefore most dynamic point of the spleen channel is principally indicated when these disorders are acute and of sudden onset. According to the classic of difficulties, Jingwell points are indicated for fullness below the heart, while the region below the heart specifically refers to the upper epigastrium. Like many of the Jingwell points, spleen 1 treats fullness in the chest region as a whole. The spleen primary channel ascends through the chest and lateral costal region connecting with points GB24, liver 14, lung 1, and terminates at spleen 21 from where the great blue connecting channel of the spleen. Like the spleen sinuous channel, spreads into the chest, ribs, and lateral costal region. Spleen 1 as the starting point of the channel is especially effective at treating the opposite end of the channel and is indicated for a variety of disorder such as heat in the chest, fullness of the chest, dyspnea, and sighing. The spleen channel links with the heart, reinforcing the close physiological relationship between the two songs. Spleen 1, like many of the jingle points, is indicated for disorders of the heart and spirit. In this case, agitation of the heart, mania depression, and propensity to sadness. Like stomach 45, it is specially used for insomnia with excessive or restless dreaming and nightmares. And in clinical practice, these 2 points may be combined for this purpose. Such is its action on the spirit that it was included by San Simao under its alternative name of Gilay, Ghost Fortress, among the 13 ghost points for the treatment of mania depression and epilepsy. Finally, spleen 1 shares with most of the other Jingwell points the action of reviving and restoring the senses, and it's is indicated for loss of consciousness. Thank you for your attention.
Let's discuss Heart 7, Spirit Gate, SHENMEN, as a source point. Heart 7 is located on the ventral aspect of the wrist joint space, the most distal wrist crease, radial to the insertion of the tendon of the flexor carpi ulnaris muscle. How to find Heart 7? Position the forearm in a relaxed, supinated position. As the location of the wrist crease can vary, the proximal border of the pisiform bone should be used for reference instead. Heart 7 is located radial to the insertion of the tendon of the flexor carpi ulnaris muscle in a depression proximal to the pisiform bone. Then you locate Heart 6, Heart 5, and Heart 4 are all located on a line on the radial aspect of the tendon at 0.5 Sun intervals. Also located on the wrist crease are pericardium 7, between the tendons of the palmaris longus and the flexor carpi radialis muscles, and lung 9 on the radial aspect lateral to the radial artery. Needling should be 0.3 to 0.5 Sun vertically or transversely deep to the tendon, parallel to the wrist crease, 0.5 to 0.8 Sun. Caution, ulnar artery or nerve, and this is a painful point. Actions, indications of Heart 7, regulates and strengthens the heart, the blood and yin, calms the Shen, clears heat from the heart channel, moves qi locally for disorders of the wrist. Special features: Yuan-source point, shoestring point, earth point, sedation point, and a major point for calming the Shen. Heart 7 is the most important point on the heart channel and one of the major points of the body. It can be used in virtually any heart pattern in order to calm the mind, which is its main action. However, it primarily nourishes heart blood and is the point of choice for heart blood deficiency, causing the mind to be deprived of its residence, resulting in anxiety, insomnia, poor memory, palpitations, and a pale tongue. It is a gentle point and therefore not the choice point in excess patterns of the heart, characterized by heart fire or heart phlegm fire, for which other points would be better indicated, such as pericardium 5 or heart 8. It is, however, the best point to calm the mind when there is anxiety and worrying under stressful situations. As the heart is the residence for the mind, which in Chinese medicine includes mental activity, thinking, memory, and consciousness, Heart 7 has an effect not only on emotional problems such as anxiety, but also on memory and mental capacity. In fact, Heart 7 can be used for mental retardation in children. The heart is connected to the kidneys within the lesser yin, and the heart points have an effect on some kidney functions, and especially the menstrual function in women, and the urinary and sexual functions in both men and women. With regard to menstruation, Heart 7 nourishes heart blood, and this influences the uterus via the uterus vessel, Paumai, in a similar way to liver blood. Heart 7 can be used to nourish blood in menstrual problems such as amenorrhea or scanty periods. Due to the connection between heart and kidneys, Heart 7 can be used for impotence in men and lack of sexual desire in women. The heart channel also has an anti-itching effect, and Heart 7 and Heart 8 are the two best points to achieve this effect. Therefore, Heart 7 is very useful in skin diseases such as eczema to stop itching. Heart 7 also has an antispasmodic effect and frequently for this purpose in chronic backache from a kidney deficiency, especially in men when there is a pronounced stiffness of the back. A very effective combination is that of SI3 on the left and bladder 62 on the right to open the governing vessel, the tumai. Heart 7 on the right and kidney 4 on the left. After retaining these points, use bladder 23, bladder 26, and the extra point, Shi-Chi Wiksha, below the tip of the fifth lumbar vertebra. With regard to the antispasmodic effect of Heart 7, it is very useful to treat tremors of the arm, as in Parkinson's disease. So here we have the governing vessel and the heart point combination for backache. Heart 7 is a good point to use in the syndrome of gallbladder qi deficiency, manifesting with timidity, fearfulness, indecision, and depression. For this syndrome, you have to use Heart 7 with gallbladder 40. Interestingly, the ancient classics do not always stress the use of Heart 7 for emotional or mental problems. For example, the ABC of Acupuncture, written in AD 282 by Wang Fumi, says only that this point is used for cold hands, vomiting of blood, and rebellious qi. The 1,000 Ducat prescriptions, written in AD 652 by Sun Si Miao, says that this point can be used for contraction of the arm. So here we have the therapeutic range of Heart 7. So it's very good for the mind, Shen, menstruation, sexual dysfunction, stops itching, antispasmodic, and stops tremor. To summarize, Heart 7 calms the mind and opens the mind's orifices. So it's very good for insomnia, poor memory, manic depression, inappropriate laughter, shouting at people, sadness, fear, mental restlessness, agitation, palpitations. Heart 7 is the most important point to nourish heart blood. It can treat impotence in men and lack of libido in women. Heart 7 stops itching in skin diseases, has an antispasmodic effect, good for backache in men, and good for tremors of the arm, as in Parkinson's disease. With gallbladder 40, Heart 7 strengthens the mind and promotes decisiveness. Thank you very much for your attention.
Let's now discuss Spleen 4, the grandfather-grandson point of the Lu connecting points. Spleen 4 is located in the depression distal to the base of the first metatarsal bone on the border of the red and white skin. So how to find this point? When palpating along the border of the red and white skin in the sole and dorsum of the foot, it is on the medial aspect of the midfoot from the proximal towards medial. The base of the metatarsal bone forms a distinct bony prominence. Spleen 4 is located in the depression distal to this prominence at the junction of the shaft and the base of the bone. Spleen 3 is located slightly more distally at the junction of the head and the shaft of the metatarsal bone. Bladder 64 is located in a comparable position on the lateral aspect of the midsection of the foot at the junction of the shaft and the base of the fifth metatarsal bone. Spleen 4 is needled 0.5 to 1 tune vertically or obliquely from medial towards lateral. Caution, this point may be very painful with needle. As for its actions and indication, spleen 4 strengthens and regulates the spleen chi, eliminates dampness. It calms the shen, benefits the heart and chest. It regulates the chongmai and the local point, for example, in metatarsalgia. Special features, it is a low connecting point. It is also the opening or master point of the chongmai. It is an important point for distension and pain in the upper and lower abdomen caused by chi stagnation, blood stasis, or obstruction due to dampness. This is a complex point with a very wide sphere of action. Spleen 4 is used for excess patterns of the stomach and spleen, such as retention of dampness in the epigastrium, stasis of blood in the stomach heat, and stomach chi rebelling upwards. It is therefore used to dispel fullness in the epigastrium and to stop epigastric or abdominal pain. Its other functions derive from its relation with the penetrating vessel or the chongmai. This vessel is the sea of the 12 channels as well as the sea of blood. It enters the uterus and regulates menstruation. Spleen 4, by activating and regulating the penetrating vessel, regulates menstruation and stops excessive bleeding, also by reinforcing the spleen function of holding blood. The penetrating vessel goes through the heart, and its syndrome of rebellious chi affects the heart and mind. For this reason, this point can be used for anxiety, mental restlessness, chest tightness, and pain and insomnia. All connecting or loop points of the yin channel stops bleeding in the appropriate channels. Spleen 4 therefore stops bleeding from the digestive system. However, by its connection with the penetrating vessel, which is the sea of blood, it can stop bleeding from any part of the body. The penetrating vessel also controls all the blood connecting channels. The penetrating vessel's descending branch goes to the arch of the end sole of the foot and then the big toe. For this reason, spleen 4 can treat pain, coldness, and numbness of the feet and problems of the big toe. The minute connecting channels are capillary-like channels distributed superficially throughout the body, and they are branches of the connecting channels themselves. This name would be quite plausible, as the penetrating vessel, of which this point is the opening point, controls the network of minute connecting channels all over the body. In addition, the spleen itself controls the secondary channels through its point spleen 21. Here is an illustration of the minute connecting channels relative to the connecting channel and the main channel. Okay. The book, An Explanation of the Acupuncture Points, has an unusual interpretation of this point's name. It says that spleen 1 pertains to wood, spleen 2 to fire, spleen 3 to earth. Wood generates fire, which generates earth. This can be compared to 3 generations of grandparent, parent, son, or daughter, in which spleen 1 would be a grandparent, spleen 2 a parent, and spleen 3 a son or daughter. Therefore, spleen 4 would be the grandchild. However, following this logic, all points along a yin channel could be called the grandchild and the text fails to explain why only the spleen channel's fourth point takes that name. Finally, Hong Sun was also the name of the Yellow Emperor, so that this point name could be also translated as the Yellow Emperor. This could be a reference to the position of the penetrating vessel as the central, most important of the 8 extraordinary vessels, for which reason it was compared to the father within a family. So to summarize spleen 4 functions, it is an important point for excess patterns of the middle burner, as in fullness and pain. It is also an important point to regulate the intestines for excess patterns, like in fullness and pain. It is the opening point of the penetrating vessel. It calms the mind and opens the mind's orifices for cases such as anxiety, mental restlessness, chest pain, and tightness. It also stops bleeding, especially from the intestines and uterus. It regulates menstruation, especially painful periods. And finally, it benefits feet and toes, like in cold feet, numbness of feet, pain in foot, fungal infection of the big toe. Thank you for your attention.
Now we go to the back transporting points, bladder 21, stomach shoe. Bladder 21 location is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the 12 thoracic vertebra. How to find? In a seated position with the arms hanging down, the spinous process of T7 is approximately on the level of the inferior angle of the scapula. From there, count down 5 spinous processes to the spinous process of T12. Bladder 21 is located on the level of the lower border of its spinous process and 1.5 June lateral to the midline at the highest point of the paraspinal musculature. Or palpate for the articulation of the most inferior rib with T12 and locate bladder 21 1.5 June lateral to the lower border of its spinous process. Or use lumbar spine for reference. Located on the same level are point of EXB2, 0.5 June lateral to the midline, and bladder 53 June lateral to the midline. Needling 0.5 to 1 June obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie down in a supine position during needling retention. The needles can be secured with tape. Caution, pneumothorax. For the action and indication, bladder 21 regulates the stomach, descends counterflow chi, harmonizes the middle burner, eliminates dampness and food stagnation. It opens the channel. Special features, bladder 21 is the back shoe point of the stomach, main point for regulating any dysfunction of the stomach. Bladder 21, like bladder 20, to tonify stomach and spleen chi. It tonifies both stomach chi and spleen chi and is often combined with bladder 20 to tonify chi and blood in general. The main difference with bladder 20 is in the direction of chi stimulated by the point. Bladder 21 stimulates the descending of stomach chi, whereas bladder 20 stimulates the ascending of spleen chi. Hence the use of bladder 21 to subdue ascending stomach chi when this causes belching, hiccup, nausea, and vomiting. Bladder 21 also resolves dampness by tonifying spleen chi and promoting spleen function of transformation and transportation of fluids. Finally, when needled with reducing method, bladder 21 stimulates the descending of stomach chi and relieves retention of food in the stomach, the cause of fullness of the epigastrium, sour regurgitation, and belching. Summary of function, bladder 21 subdues rebellious stomach chi, like epigastric pain, epigastric distension, and fullness, vomiting, sour regurgitation. It tonifies the stomach, those with thin body, lack of appetite, tiredness, weak limbs. It also resolves dampness, like having an edema, jaundice. Bladder 21 is the backshew point of the stomach, stomach fu, where the chi of the stomach emanates from the interior to the body surface and is a powerful point to treat all diseases of the stomach, as well as to regulate the middle jiao as a whole. According to the spiritual pivot, the stomach is the sea of water and brain. Its function is to receive food and drink, rot and ripen it, and descend it to the small intestine. Most pathology of the stomach, therefore, involves impairment of its descending function. This may be due to deficiency of stomach chi or stomach yin. Excessive cold, heat, or dampness, whether of internal or external origin, stasis of blood in the stomach, stagnation of food, or invasion of the stomach by liver or gallbladder chi. Failure of the stomach descending function leads to stagnation of chi and hence distension, fullness, and pain of the epigastrium and abdomen, while upward rebellion of the stomach chi leads to stomach reflux, nausea, and vomiting. Whatever the pattern, whether deficient, excess, hot, or cold, bladder 21 is a primary point to reestablish harmony of the stomach. It is interesting to compare the action and indication of bladder 21, the backshew point of the stomach, with stomach 36, the HESI point of the stomach channel. Both have an equally strong action on regulating disorders of the stomach food, but bladder 21 shares none of the ability of the Susan Lee stomach 36 to tonify and nourish the chi and blood of the body as a whole. The stomach and spleen are interiorly, exteriorly related, and the descending of stomach chi and ascending of spleen chi together dominate the whole process of this digestion. By virtue of this close relationship, bladder 21 is able to regulate this harmony of both the stomach and spleen, giving rise to abnormal ascent of the stomach chi, like vomiting, abnormal descent of the spleen chi, like diarrhea, and failure of the spleen transportation and transformation function, like bugbrigmus and edema. A healthy appetite is a sign of the harmonious functioning of both the spleen and stomach, and bladder 21 is indicated in various disorders affecting the appetite. Poor appetite may be due either to deficiency of the stomach and spleen, which lack the force to rot and ripen and transport and transform what is eaten, or to various forms of excess which lead to stagnation of food in the stomach and hence lack of desire and inability to take in more food. Hunger with inability to eat is due to insufficiency of stomach yin with consequent deficiency heat, the heat stimulating desire to eat. The yin deficiency and resultant dryness causing inability to digest what is eaten. Excessive eating without gaining weight is a sign of stomach heat, with or without spleen deficiency. Bladder 21 is indicated in all such cases. Thank you for your attention.
Let's talk about stomach 25, the heavens pivot, Tianshu, a front collecting point or an alarm point. Stomach 25 is located tutsun lateral to the umbilicus. How to find? Measure tutsun lateral from the center of the umbilicus. For reference, on the abdomen, tutsun lateral corresponds to the midpoint between the anterior midline and the mammillary line. Located on the same level are Ren 8, kidney 16, spleen 15, GB 26. So that's the location. These are located On the umbilicus, 0.5 Sun lateral to the umbilicus, the mammillary line or 4th Sun lateral to the umbilicus, at the level of the umbilicus and directly inferior to the free end of the 11th rib, respectively. Niggling of stomach 25 should be done vertically, 0.5 to 1.5 Sun. For gynecological disorders, needled obliquely in an inferior direction towards the uterus. Caution, peritoneum pregnancy. The needle may reach the aponeurosis of the oblique abdominal musculature at the transition to the sheath of the rectus abdominis muscle. Actions, indications of stomach 25, regulates the spleen, stomach, and intestines, eliminates dampness and clears damp heat, eliminates stagnation. Special feature, it's the front move point of the large intestine, important point for disorders of the GI tract. Stomach 25 is a very frequently used point. It can be used in all excess patterns of the stomach, giving rise to abdominal rather than epigastric problems such as abdominal distension and pain. It is particularly indicated to stop diarrhea from spleen deficiency. As a front move point, it is especially indicated in acute patterns of the large intestine. When used with direct moxibustion, stomach 25 tonifies and warms the spleen and the intestines, and is a special point for chronic diarrhea arising from spleen-yang deficiency. In this case, it is combined with REN6 and stomach 37. In the context of diseases from invasion of exterior wind heat, stomach 25 is an important point to use in the bright yang stage of the 6-channel pattern identification, or at the chi level of the 4-level pattern identification. In these cases, stomach 25 is combined with LI11. From a psychological point of view, it is effective in mental irritation, anxiety, schizophrenia, and mania when these are due to a stomach disharmony, particularly excess patterns of the stomach, such as phlegm fire in the stomach. An important characteristic of stomach 25, compared to the ones mentioned, is that it affects the uterus and menstruation, and it is frequently used for painful periods to move qi and blood. This point resolves dampness in the intestines and edema. As stomach 25 resolves dampness, it may also treat diarrhea from dampness. Stomach 25 is therefore a very important point for diarrhea, as it can treat both that from spleen deficiency and that from dampness. Consider this point essential to treat all bowel problems. For these diseases, combine stomach 25 with bladder 25, stomach 37, and stomach 39. Summary: stomach 25 is used in all excess patterns of the stomach, giving rise to abdominal problems rather than epigastric. Stops diarrhea from spleen deficiency, especially indicated in acute patterns of the stomach and intestines. An important point to use in the bright yang stage of the 6-channel pattern identification, or the chi level of the 4-level pattern identification, to clear interior heat in stomach and intestines. From a psychological point of view, stomach 25 is effective in mental irritation, anxiety, and agitation due to a stomach disharmony, particularly excess patterns of the stomach, like phlegm fire in the stomach. Stomach 25 affects the uterus and menstruation, and it is frequently used for painful periods to move qi and blood. Stomach 25 resolves dampness in the intestines and edema. Although stomach 25 is obviously on the stomach channel, it is more important as a point for the intestines. It is the front mu point for the large intestine. It also affects the uterus. Thank you for your attention.
Let's now move on to triple burner 7 or Sanjiao 7, the ancestral meeting point of the accumulation or she cleft points. Sanjiao 7 is located 3 chun proximal to the dorsal wrist joint space or the dorsal wrist crease and 0.5 chun ulnar to the center of the forearm. How to find? As the location of the dorsal wrist crease varies, the wrist joint space should be used for orientation instead. By moving the patient's wrist in a relaxed way, the joint space becomes more easily palpable. From the joint space, measure 3 chun in a proximal direction and locate Sanjiao 7 in a depression between the ulna and the extensor digitorum communis muscle. Or we can use the spreading hands technique. We place the little fingers on the elbow crease and the wrist joint space respectively. This distance corresponds to 12 chun. Divide this distance into quarters and locate Sanjiao or triple burner 7, 1/4 of the distance from the wrist joint and 0.5 chun ulnar to the center of the forearm, where triple burner 6 is located and on the border of the ulna. It is located at the same level with triple burner 6, which is 0.5 chun towards the radius. Triple burner 7 is needled vertically or obliquely up to 1.5 chun. For its indications and actions, it opens the channel and alleviates pain, and it benefits the ears. For its special features, it is the chic left point of the triple burner. Like all accumulation points, triple burner 7 can be used in acute excess patterns to stop pain. Its areas of action are the ears, temples, and eyebrows. It is also effective for muscle ache in the arms in post-viral fatigue syndrome. In summary, triple burner 7 removes obstructions from the channel, like pain in the arm and shoulders, pain in the elbow, pain and contraction of the fingers. It also benefits the ears in cases of tinnitus, deafness, and earache. For in combination with other points, it can be used in impaired hearing and deafness. We combine Sanjiao 7 or triple burner 7 with Sanjiao 5. For deafness, we combine Sanjiao 7 with Sanjiao 17 and stomach 7. Sanjiao 7 or triple burner 7's name indicates the respect and veneration in which the Chinese hold their ancestors. This assembly or convergence gathers to re-establish order and propriety within the three-heater and the fire element. Sanjiao 7 is level with Sanjiao 6. 2 points at the same level is usually significant, amplifying the resonance of qualities held between them. Sanjiao 6 as the aurari point within fire gives access to the fire within fire. The purity and guidance of the Shen alongside Sanjiao 7, another important point alluding to guidance and overseeing. Situated in a divergence from the straight path of the meridian, Sanjiao 7 allows for time out, a convergence before the straight onward path of the meridian resumes. When the three-heater is disturbed, life feels jangly and discordant, as if nothing will come into orderly focus, and all the officials may soon express their discomfort and distress. The three-heater's role of regulation is so important to our sense of well-being that if it is lost, many different symptoms can arise in the body, mind, and spirit. The natural, healthy sense of a deep joy in life may well be disturbed, or the emotional weather may alternate wildly if the three-heater feels out of control and rushed, or conversely overpowered by sadness. Then it is appropriate to take time to call on the deep wisdom associated with the ancestors or collective unconscious. This point is considered an assembly of ancestors and can gather sufficient resources to restore composure and perspective. It is a plentiful point. It is an assembly of many ancestors, not just one. This point can restore the steadiness of mind needed when the three-heater starts to lose control within the body, mind, and spirit. Qi cleft or accumulation points are points where the qi gathers and they help the mind regain clarity and perspective. As Ellis, Wiseman, and Boss in 1989 say, this point could be named for a meeting of officials during the summer in ancient China. Zhong was the term used for such a gathering. As a Qi cleft point, it is useful for acute diseases, and it can also be used to activate the meridian and alleviate pain in the arm and ear, temples, and eyebrows. It activates the meridians, and finally, it benefits the ears. Thank you for your attention.
Now we continue with the 4 C's. Stomach 30, rushing qi. Stomach 30 location is two-tune lateral to the upper border of the pubic symphysis and medial to the femoral artery and vein, approximately 1 tune superior to the inguinal groove. How to find? First, locate the upper border of the pubic symphysis location of REN 2. Then locate stomach 30 two-tune lateral from there on the vertical line halfway between the anterior midline and the mammillary line. This often corresponds with the location 1 tune superior to the inguinal groove and medial to the femoral artery and vein. Located on the same level are REN 2, kidney 11, spleen 12. Anterior midline, 0.5 tune lateral to the anterior midline, 3.5 tune lateral to the anterior midline. Liver 12 is located in the inguinal groove, 1 tune inferior and 0.5 tune lateral to the stomach 30. Needling, 0.5 to 1 tune vertically or 1.5 tune slightly obliquely towards the external genitalia for disorders of the urogenital tract. Caution, femoral artery, urinary bladder, quite superficial in a superior direction. In men, the spermatic ducts quite superficial in an inferior direction. Pregnancy. Ask the patient to empty their bladder before needling this point. For the action and indication, stomach 30 regulates the qi in the lower burner, strengthens the sea of grain, later heaven qi. For the special features, stomach 30 is the meeting point with Chongmai, according to some authors, also with GB channel. Sea of grain point, wide usage for disorders of the lower burner. This is a powerful point with many different actions. Most of its action are due to its being a point of the penetrating vessels, the Chongmai, and the Chong in its name refers to the Chongmai. Indeed, it is a very dynamic point because it is the point from which the penetrating vessel emerges from the interior. First of all, it moves qi and blood in the lower abdomen, uterus, and genitals, and is therefore indicated in many abdominal and genital problems of an excess nature, such as abdominal pain, abdominal masses, hernia, painful period, swelling of penis, retention of placenta, and swelling of prostate. Stomach 30 is on the penetrating vessel, and since this vessel is the sea of blood, this point strongly invigorates blood. Being a point on the penetrating vessel, it can be combined with its opening and coupled points. Spleen 4, PC6, to enhance its action and direct the therapeutic effect to the lower abdomen and genitals. It is an important point to subdue rebellious qi of the penetrating vessel in conjunction with its opening and coupled point spleen 4, pieces 6. Being the point of the sea of food means that it stimulates the stomach function of rotting and ripening, and the spleen function of transformation, thus generally revitalizing the digestive system and tonifying qi. Finally, since it is simultaneously a major point of the penetrating vessel and the sea of food, it is the link between the root of the pre-heaven qi, the kidneys, and the root of the post-heaven qi, the stomach. Because of this connection, it can be used to tonify strongly pre- and post-heaven qi. Stomach 30, summary functions. It moves qi and blood in the lower abdomen, uterus, and genitals, and is therefore indicated in many abdominal and genital problems from qi stagnation and blood stasis. It invigorates blood in the uterus. Stomach 30 also is an important point to subdue rebellious qi of the penetrating vessel, spleen 4 and PC6. As a point of the sea of food, it stimulates the stomach function of rotting and ripening and the spleen function of transformation. As a point of the penetrating vessel, which is the sea of blood and of sea of food, it is the link between the root of the pre-heaven qi, the kidneys, and the root of the post-heaven qi, the stomach. The name of this point may be translated as rushing qi or pouring qi. The character chong is the name as in the penetrating vessel, the chong mai. This name reflects what the ability of qi chong stomach 30 to regulate the circulation of qi in the lower abdomen and its status as the point where the penetrating vessel emerges on the abdomen. Stomach 30 has a broad action in treating many disorders affecting this area. By regulating qi, stomach 30 may be used to disperse stagnation, pain, cold, and heat in the genital region, intestine, bladder, and the abdomen as a whole, and is indicated for such disorders as pain, fullness, and distension of the lower abdomen, abdominal heat, twisting pain in the abdomen, heat in the large intestine, retention of urine and feces, hot painful urinary dysfunction, stone edema, etc. The penetrating vessel merges at the perineum and meets the stomach yang min channel at stomach 30. The penetrating vessel influences the lower abdomen as a whole, including the genital organs, and especially helps regulate the function of the uterus and menstruation. Stomach 30 is therefore indicated for such genital disorders as swelling and pain of the penis and vagina, pain and retraction of the testicles, impotence, and such gynecological and obstetrical disorder as regular menstruation, sudden amenorrhea, abnormal uterine bleeding, infertility, retention of the placenta, and difficult lactation. Thank you for your attention.
Now let's talk about chronic fatigue syndrome, specifically the patterns lung yin deficiency and stomach yin deficiency. Clinical manifestations of the empty pattern, the yin deficiencies. These vary according to organ involved. The three organs that most frequently suffer from yin deficiency in chronic fatigue syndrome are the lungs, stomach, and kidneys. Combinations of two or even all three of these are common. Lung yin deficiency, dry throat, dry cough, exhaustion, breathlessness, hoarse voice, feeling of heat in the afternoon and night sweating, tongue without coating, possibly only in the front part. There may be cracks in the lung area. So this is how the tongue would look like in a person with lung yin deficiency as the pattern for chronic fatigue syndrome. Pulse is floating, empty. This pattern frequently occurs after a febrile disease during which heat dries up the body fluids. In young adults, it can happen after glandular fever, mononucleosis, when the yin is injured by prolonged heat and gives rise to CFS. Treatment principle: nourish yin, generate fluids, strengthen the lungs. Points: lung 9, Ren 17, bladder 43, bladder 13, do 12, Ren 12, stomach 36, spleen 6, do 20. All are needled with reinforcing method, no moxa. Lung 9 and Ren 17 tonify the lung yin and lung qi, respectively. Bladder 43 nourishes lung yin and is particularly indicated for chronic conditions. Bladder 13 and do 12 tonify lung qi. Ren 12, stomach 36, and spleen 6 tonify stomach and spleen and generate fluids. In particular, Ren 12 also tonifies the lungs, as the deep pathway of the lung channel starts at this point. 220 clears the brain and leaves mood. Now let's go to stomach yin deficiency. Dry mouth, no appetite, tiredness, dry stools, slight epigastric pain, malar flush, and thirst with no desire to drink, or a desire to drink only in small sips. Tongue, normal body color, midline crack in the center, rootless coating or no coating in the center, transversal cracks on the sides indicating chronic spleen qi and spleen yin deficiency. Pulse floating empty on the right middle position. The residual heat that follows a febrile disease dries up the stomach fluids and often causes stomach yin deficiency. Treatment principle: nourish yin, strengthen stomach and spleen. So this is the case histories pathology. As you can see, we now have kidney yin with empty heat. Points: stomach 36, spleen 6, Ren 12, stomach 44, do 20. All are needled with reinforcing method. If the tongue body is not red, a little moxa can be used on stomach 36. Stomach 36, spleen 6, and Ren 12 nourish the stomach yin. Stomach 44 clears stomach heat or empty heat, and do 20 clears the brain and leaves the mood. Thank you very much for your attention.